I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi. This episode is everything you need to know about menopause. Before I get into it, the first thing I want to make very clear is that I'm not giving any type of religious or medical advice. So if you have any questions concerning your health, please speak to your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. It's the Muslim Sex Podcast because I just happen to be a Muslim woman who talks about sex. And today I have my sister here, Rafia Lodhi.
Hello.
And she's just going to be hanging out with me. And we are going to be talking about menopause. So, hey, Raf.
Hey, Sadaf, or Dr. Lodhi, as people call you. We're in the South, and we really want to know about women and menopause.
All right. So, just to kind of go over what menopause is. Menopause is the time in a woman's life when she's no longer having periods. So when a woman goes a whole year without a period, that's considered menopause. So if you go a whole 11 months and then all of a sudden you get your period, you're not in menopause yet. You have to go a whole year without any bleeding to be in menopause.
Is there an age range for women when they start menopause?
Mm-hmm. Yeah. So, here in the U.S., it's considered around 51, 52. So 52 years of age is typically when women will go through menopause.
Okay. And so in our previous podcast, we spoke about perimenopause and we spoke about its symptoms. What are the main symptoms of menopause?
Yeah. For menopause, they're pretty much the same. Women will a lot of times, and remember, most of these symptoms are due to decreased levels of hormones in our body. So decreased estrogen and progesterone in our body, primarily estrogen. And so the symptoms that women tend to experience are hot flashes, night sweats, mood swings, vaginal dryness, and they will experience also dry skin and also vaginal dryness. So that's really important. Sometimes women have a hard time focusing, and that can also be due to the decreased estrogen. Women also may notice that their emotional health is affected, like they may have a tendency to feel more depressed at times, also may experience some mood swings. Mm-hmm. So all of those things are very important to know. They may also have sleep disturbances and notice some lower energy, during this time of their life. So very important to be aware of your symptoms, and especially if they start to impact your quality of life, to go and be assessed and treated if you can. By your medical provider. Remember, menopause and perimenopause are not, they're not diseases, right? They're just transitions in our lives that happen, and it's all a normal part of aging. And, it's very important to embrace that part of our life. However, if the symptoms start to, affect our activities of daily living, then that's when it's important to be treated.
Yeah. So you talked about treated. Are there any treatments for menopause?
Mm-hmm. Again, it's based on whatever symptoms women are experiencing. So, for example, vaginal dryness is a big one. And a lot of times women in menopause will notice vaginal dryness and pain with intercourse due to that vaginal dryness. Mm-hmm. And so it's going to be important that, if women desire to have intercourse but are afraid that it is going to be painful, that they get an estrogen cream. Sometimes that will help. And a lot of times what that does, it helps with the tissue. And so what can happen in menopause is that tissue all over the body can become dry. and thin out, but specifically in the vagina. And so, if that happens, then it's important to get vaginal estrogen cream, because that will help to plump up that tissue in the
Mhm.
vagina, and therefore making intercourse, not as uncomfortable. And remember, if that tissue really starts to become thin, there can be some tears in that tissue. So it's going to be important to keep that tissue healthy. And the other thing that keeps the vaginal tissue healthy is to have a healthy sexual life. And so when women are more sexually active, then there
Mhm.
is increased blood supply to the vagina. And so that also keeps that tissue, revitalized and, more plump. And so hopefully there'll be less tissue damage and dryness. And so that'll make intercourse less uncomfortable for women at that time.
Okay, so you have to use it or lose it, kind of.
Yes, yeah. So remember also that what we spoke about a little bit in that perimenopause
Mhm.
podcast was that vagina does shrink,
Mhm.
and can shrink. And so
Yeah.
women that don't have intercourse during that time, and remember, menopause is like, in your early 50s. So if you decide not to have intercourse and not to have intercourse for a long time, that, like I just mentioned, is that tissue, the vagina shrinks, and that women may need to use dilators then at that
Mhm.
point, depending on how long it's been that they've had intercourse. And it may become even more uncomfortable. So it could become a vicious cycle where that tissue becomes thin and what we call atrophic, and then it becomes uncomfortable, and so then women don't have intercourse, and then when they decide to have intercourse, it becomes painful. So
Mhm.
it's just going to be important to be aware of that, and if there's any discomfort, to let your gynecologist or your healthcare provider know, so that they can help you
Mhm.
relieve some of those issues that you're having, some of that discomfort.
So how long generally does menopause last?
So menopause is forever. So
Oh.
it's, once a woman goes through menopause, she's
Mhm.
not having periods anymore. And that's really what
Mhm.
that means, right?
Mhm.
So meno is like menstruation, and pause is that you no longer are having periods. So once a woman stops having periods, it's done, it's gone, it's forever. So, menopause is a part of our lives as women, that is until, you know, is forever. Yeah,
Yeah.
there's no.
So when women are in menopause and, for example, can they start bleeding again?
Mhm.
And is that normal?
Yeah, so that's a great question. So what happens is that women, when they're in menopause, really should not bleed again. It
Yeah.
should be done. It's
Mhm.
once they're in menopause, for the bleeding is done forever. Now,
Okay.
if women start to have bleeding during menopause, then that's a sign that something else is going on. And,
Yeah.
it's very, very important. It's what we call postmenopausal bleeding. So
Mhm.
it's going to be very important that women go and be assessed, and that the lining of that tissue be evaluated. Because what can happen is that sometimes that can be the first sign of endometrial cancer or uterine cancer,
Oh.
is that postmenopausal bleeding. Yes.
Okay.
So anytime a woman notices bleeding after
Mhm.
menopause, and again, I just want to state that menopause is a whole year without a period. So once a
Mhm.
woman goes into that phase of her life, and if she starts to bleed again, then she absolutely has to go to her doctor's office and be evaluated, even if it's just spotting. And
Mhm.
typically what we'll do at that time is we will, get a full history, and then we'll also get an ultrasound. And what
Okay.
that ultrasound is looking for is it'll take a look at that uterus, the tubes and the ovaries, and the thickness of the lining of the
Mhm.
uterus. And if that thickness is greater than, typically we say like 4 millimeters, then we will do a biopsy of lining of the tissue. And sometimes, practitioners, if they have a high index of suspicion that it might be uterine cancer, then they'll go ahead and they may just go ahead and do an endometrial biopsy, because that's typically what we do anyways, because that way you get a piece of the tissue, and we go ahead, we send it to pathology, and we make sure that it is not cancer. So that's why that's so important to rule that out. And like I said, postmenopausal bleeding is one of the first signs of uterine cancer.
Okay.
Yeah.
That's scary.
Yeah.
But it's good to
Yeah.
know. We need to know this information, because I didn't know that, and now I'm a little bit more educated on the topic, which is good. The
Yeah.
more
Yeah.
you
Yeah.
know.
It's absolutely. Absolutely. And, another risk factor can be obesity. So when women are morbidly obese, what can happen is that our fat cells also can promote lining the tissue in the uterus. It can promote that, because what happens is that fat tissue can lead to increased estrogen, and that estrogen production can lead to the lining of the uterus increasing, and that can lead to postmenopausal bleeding. So, for example, say if a woman was morbidly obese and she came in, she told me that she had gone through menopause, like 2 years ago, and now all of a sudden she's bleeding, I would have a high index of suspicion that perhaps she may have uterine cancer because of that unopposed estrogen, that she has, and that's causing that tissue in that uterus to start growing, and then so when she starts bleeding, that may be a sign of uterine cancer. Not always. So I don't want the listeners to go away thinking that if they have postmenopausal bleeding, all of a sudden they have uterine cancer, and that's not the case. But there is that is one of the biggest signs of uterine cancer, is that postmenopausal bleeding, and that's why it's important to go and be evaluated by a practitioner and get that biopsy, and to make sure that you don't have it.
So
Yeah.
it's a risk factor you just need to be aware of.
Yeah, obesity, right. But otherwise, right, postmenopausal bleeding is one of the biggest signs or symptoms of uterine cancer. Yeah.
It's good to know. Good information.
And, some of the other things that women can do during menopause that might help with, some of the symptoms that they're having is they may also notice, actually, during menopause, is that they have prolapse of some of the vaginal organs, uterine and pelvic organs. For example, what can happen is that sometimes you can have prolapse of not only the vagina, but also the uterus. And that's because of the laxity of those tissues that can happen during that time.
Okay, so let's back up a little. What is prolapse?
So, prolapse is when like an organ,
Uh-huh.
like for example, the uterus,
Yeah.
that is typically suspended up in the pelvis, right, by like the ligaments in the pelvis. And if that falls down into the vagina, sometimes that can happen as we age, because our tissues become a little bit weaker. And a lot of times, one of the first signs will be that a woman may feel like a bulge in the vagina. She may feel pressure in the vagina. She may feel like something is starting to come out. And when we, as gynecologists or healthcare providers, do that exam, we'll notice that there is something starting to come out. It could be the cervix, and that's typically the first thing that we see is the cervix, because remember, the cervix is the end of that, the bottom part of the uterus, and that may be what's coming out into the vagina. And so when you have an organ that is in the pelvis, right, start to come down into the vagina, that's called prolapse. Or you can also there can be a prolapse of the bladder that falls into prolapse is basically something that starts to like fall down. Okay. So it can be like the bladder coming into the vagina, or it can even be, that's called like what we call a cystocele, and or you can have Part of like with a lot of straining, sometimes women have constipation, and if they strain a lot, they can have what's called a rectocele, which is like an outpouching of the rectum into the vagina. Okay, so so
Wow, that's kind of scary.
so yeah, I know, right? You're learning a lot of stuff.
I'm learning a lot. I'm getting my education. I love it.
So yeah, so anytime you have any of those things starting to come into, like, basically it's like a bulge.
Okay.
Okay. So anytime you have any of those bulges coming into the vagina, that's like a prolapse. So it can be either the uterus coming down into the vagina, it can be the bladder falling into the vagina, and remember, it's not like the whole bladder, but it's
Right.
like, part of the bladder.
Does
And
exercise help? Any type of exercise to prevent this?
Yeah, I mean, you can try to strengthen your pelvic floor muscles, right? And so a lot of times we'll suggest like Kegel exercises,
Mhm.
right? And that helps to, and so that's why it's so important to maintain the integrity of those muscles in the vagina,
Got it.
because that will hopefully prevent some of those prolapses from happening, and sometimes it just can't. Sometimes that tissue is just too lax and, will start to come down on its own. But the Kegel exercises are definitely some ways that you can hopefully prevent some of this prolapse from occurring. Sometimes just the weight of, even if a woman was pregnant in the past, just the weight of the
Mhm.
childbirth, carrying a baby for like 9 months, right, can cause those tissues to become a little bit weaker. So that's why it's important for women to do those Kegel exercises
Yeah.
to support that.
So having multiple pregnancies, does that affect it as well? Because every time you have it.
Yeah,
Yeah. Okay.
yeah, yeah. It's that pressure, right,
Okay.
in that pelvic structure. And, they say sometimes women that have had vaginal births, that
Hmm.
pushing
Yeah.
that they do to deliver that baby
Hmm.
can also result in prolapse,
Okay.
right? So they can have some of that uterine prolapse, or that what we call that cystocele or that rectocele,
Hmm.
due to all those pushing forces that happened
Okay.
during childbirth. So sometimes that can affect it as well, but remember, not all women will have that. So
Yeah.
some women will have a vaginal birth and not experience any of these things, right? And
Yeah.
not have any type of prolapse. So it really is based on your tissue integrity. And they've noticed also that some women that have never had or have been pregnant have also had
Oh,
prolapses,
wow.
right? So yeah, or women that have had
Yeah.
C-sections,
Yeah.
um, can experience some prolapse. So it's really based on your tissue integrity
Okay.
and how strong those pelvic floor muscles are. So that's why it's important for us to continue to do our Kegel exercises
Okay.
to prevent that, hopefully.
All
Yeah.
right.
Some women also in menopause, will experience lowered libido,
Oh, okay.
right? And
Yeah.
again, that's due to the lack of estrogen,
Hmm.
right? So you can now, before in the past, they didn't have much in terms of medications for that for women, but now there have been new pharmacologic therapies that have come out to help with libido in women.
Okay.
Again, there is hormone replacement therapy as well
Okay.
for women during menopause to help alleviate some of those symptoms
Hmm.
of, you know, what we say vaginal dryness, or those mood swings and night sweats and hot flashes.
Yeah.
But typically, if you go to a gynecologist's office, they won't. Hormone replacement therapy isn't typically the first thing that we do, just because there's been a lot of mixed research regarding hormone replacement and the role that estrogen plays. And estrogen has been known to cause blood clots and and stroke, and so that's why it's not always our first line. However, they say that hormone replacement therapy helps the most in women within the first 10 years of them going through menopause, and used for the least amount of time. So that's typically what we do, is that basically whatever helps a woman get through that initial stage of going into menopause, that's how long we like to prescribe the hormone replacement. but we don't typically like to prescribe hormone replacement forever.
I mean, I think that's a great topic for your next podcast, hormone replacement therapy.
Yeah. Yeah, absolutely. Absolutely. Yeah, I know it's, there's definitely been a lot of research in it, and there have been different studies that have been done on it. And, there's still more studies that come out with in regard to hormone replacement. Um, Another topic that I'll touch briefly on are bioidentical hormones. There was a thought before that it was better for women to take bioidenticals instead of the FDA approved hormone replacement, but then that turns out to not be the case, because a lot of times with bioidentical hormones, those are compounded in pharmacies, and there's no way to regulate and to know exactly how much or what the dose of the estrogen is that you're getting in those bioidenticals, right? Especially if they're compounded, they're not regulated by the FDA. And that's why a lot of practitioners they don't like prescribing bioidenticals, because we don't know, what exactly is in them, what percentage of hormone is in them. And so that's why if you go to your provider for hormone replacement therapy medication, they'll tell you to get the FDA approved medications, because those are at least regulated and we know how much and what dosage of hormone you're getting in each of those
Yeah. There's a sense of
pills.
security using something that's been approved by the FDA.
Right, because it's regulated,
Yeah.
it's monitored, and if there's any adverse events, those are reported. And so, whereas not the case for any type of bioidentical hormones.
Yeah.
Yeah, at least this is not obviously 100%. What you would say
To a patient.
complete.
Yeah.
Right. So, I mean, there's still so many topics in regard to menopause and in terms of treatments and
Yeah.
how we treat them, things like that. So, I don't want people to go away thinking that I've covered everything about menopause. This
Yeah.
is just kind of the tip of the iceberg
Yeah.
in terms of menopause and what it is and how it's treated,
Mhm.
and lots of therapies are coming about.
Yeah.
Also, in terms of the vagina, that tissue, with that tissue becoming lax
Mm.
and or thin, and that tissue being more what we call friable, or more prone to tears during that time. Lots of lasers have come out to improve that, they say, like vaginal rejuvenation. Yeah, they use like radio frequency to increase that, plump up that tissue, and lots of different laser therapies. And some OBGYNs actually have those in their office. Of course, insurance does not cover that, but definitely there are some type of radio frequency therapies also available for vaginal tissue.
So definitely go to your doctor. Don't miss your appointments. These are important transitions in life, so we just need to be on top of it.
Yeah, absolutely. Absolutely. So, okay, well, I think that is good for now, and I am done here. It's been real and really intimate. And remember, this is not meant to be any sort of medical advice. So if you're having any issues with your health, please definitely be sure to go see your healthcare provider. And until next time, this is the Muslim Sex Podcast.